Good evening, doctors. Welcome again. Today we are back again with Dr. KK Agarwal post COVID management. And last 2 days we have covered COVID Sutra day one, and in day two we have covered the fever. So today we are with the third episode, and in case you have missed the last 2 days session, you can just log on to the Facebook page of Dr. KK Agarwal, or you can go to MedTalks by Dr. KK Agarwal, or you can see your mailbox where you will find the FDC email. Just click that link and you can go to those sessions which we have just made. So today we are on the third day of the series, and we are going to cover the organs from today. And the first organ Dr. KK Agarwal is going to take today is lungs, what COVID does to the lung. In fact, it is my pleasure to announce you the winner of Vitcofol capsule quiz of 26th as well as 27th. So the winner of 26th November is Dr. Manisha Dhinge from Pune city and Dr. Dhirendra Samidia from Ahmedabad city. And the winner of 27th November, which is yesterday's episode, is Dr. Prachi Garg from Delhi and Dr. Gayatri Dolas from Ulhasnagar, which is a suburb of Mumbai. So again, at the end, we will be meeting you with the today's Vitcofol capsule quiz. Over to you, Dr. KK Agarwal, sir.
For starting a good series, basically on post-COVID management. We will go to the basics of post-COVID management. Because this series is supported by FDC, so remember the word F is for iron, D is for vitamin D, and C is for vitamin C, a must in COVID management. So remember the word FDC is iron, D for vitamin D, and C for vitamin C. And in iron, you require 100 milligram of elemental iron along with vitamin B12, B6, and folic acid. So the word F is for both iron and folic acid. Let's have the slides for today. Rituji. Rituji slides दिखाएंगे. So we are going to talk about post-COVID lung. Here, because we are talking about post-COVID, let us understand few definitions. Next. So there are four situations: COVID, post-COVID, long COVID, non-COVID. COVID means first 9 days when the virus is active. During this period, you can have pneumonia starting on day 3. When the virus enters my body, it will produce gamma interferon. If gamma interferon, first it will produce interferon 1 alpha. And if that reaction is good, nothing will happen. No lung will be involved. But if gamma interferon is involved, it will produce tumor necrosis factor. Patient will acquire some fever, some bronchitis. But if by day 3, the virus is not killed, in that particular situation, your body T helper 1 cells will lead to Th1 response that will cause inflammatory markers, and my lung will show pneumonia. With this pneumonia, my body will also have a hypercoagulable state. Therefore, you may have happy hypoxia, which means your CO2 is, your oxygen is low, CO2 is not. You are conscious but hypoxic. But the talk today is a post-COVID and not COVID. So we will be talking more on post-COVID means post 9 days to 3 months. During this period, you may have a lot of manifestations related to lung. Long COVID means if these symptoms persist for more than 3 months, we call them as long COVID. And non-COVID means once you have recovered, Normally, non-COVID situation is defined as 3 months. After 3 months, you are like a normal person, non-COVID, susceptible to reinfection. Next slide, please. So when we talk about post-COVID, post 9 days, so we have 5 situations. A person may be healthy. A healthy person post 9 days, what can happen to the lungs? A person may be asthmatic, allergic or non-allergic. The good news is allergic asthma do not worsen with COVID-19. A person may be chronic obstructive airway disease with recurrent inflammation. And also remember, the Ministry of Health has come out with the data that 13% of RT-PCR when done, they were also positive for gene expert test for tuberculosis. A person may also have an underlying interstitial lung disease with, when added with corona 19, can precipitate or worsen interstitial lung disease. Next. Now remember the recovery time. As per WHO, most viral disorders will recover within 2 weeks. So is corona. So mild diseases will recover in 2 weeks, but severe disease may take 3 to 6 weeks. And in this serious disease, lung is the predominant involvement. What will decide 2 weeks or 6 weeks? Age and pre-existing comorbidities as mentioned in the previous slide. Next. Now, post-COVID illness, there are 4 studies available. The first study says that only 39% of hospitalized patients return to baseline health by 3 weeks. That means most of them carried on their illness even beyond 3 weeks. Another study of Italy, which says only 13% were symptom-free at 2 months. Third study, which is available in MMF, this is a weekly morbidity report from USA. And this says in OPD patients, only 65% return to baseline health by 3 weeks. So what is the lesson we have learned is? The lesson is that 35% of the patients after 9 days when the virus is killed will still complain of symptoms. Remember, they are absolutely non-infectious. And if they are non-infectious, nothing to be done. That means they are not isolated, they are not quarantined. They have to be treated like any other ordinary person. And if you give favipiravir, which is an antiviral, in the first day and the second day, and if the virus load is reduced, maybe you may be able to reduce post-COVID illness. And also, if these patients are given timely, you are giving them minerals, vitamins, and if you make sure that they are not anemic, remember, during first 9 days, 1 to 2 gram of iron hemoglobin is lost. Therefore, if these patients are not anemic, post-COVID illness may not happen. I am not saying shall not or will not happen. I say may not happen. And hence this series, early treatment and make sure we are not iron deficient, because if we are iron deficient, our lungs may not be able to tolerate it. Next. The most common persistent symptoms are, I'm only checking it to dyspnea, which is 43%. Fatigue is 53%, maybe related to hypoxia. Dyspnea is 43. Joint pain, we don't see in India. Chest pain is 22%, which is costochondritis and not a pleural pain. Therefore, remember 43% patients of the 35% patients who have a post-COVID will have dyspnea. Now, this dyspnea is characteristics. patients will say, I improve on walking. And these patients will respond to either theophylline or to inhalers. I call them as post-COVID bronchitis, post-COVID acute bronchitis, and these patients will respond to steroid inhalers. So in your practice, when you are watching this program, first 9 days, even if the patient is seen by somebody else, post 9 days, for the next 3 months, it is your practice. All of you can start seeing patients after 9 days when the patient is non-contagious. And these are the patients who are going to become your bread and butter because they are going to have a problem for 3 months. So your job is to prevent them and also to make sure that they live a healthy life. So remember, the most common persistent symptom is breathlessness, present in 43% of the cases. Next. Now, this is another important thing. Those who did return to baseline health will do in 7 days. So this is a trick. If a patient by 7th day has not become symptomatic, he is entering into a post-COVID phase, and that may last for 3 months. So therefore, tell all these patients, somebody come back to you on 9th day and he's symptomatic. Give them treatment you make sure that this person is going to remain symptomatic for quite some time. So therefore, this is a clinical clue. 7वें दिन अगर ठीक नहीं हुआ तो लंबा चलेगा. Another thing, cough is present in 43% of the cases. 43% of the cases will also have cough. This is a dry cough, so codeine-based syrup will work. Nothing else may work. Bromoxin may work or a codeine-based syrup may work. Next. Now, up till now, people were thinking that non-healthy comorbid conditions will have a post-COVID lung involvement. The answer is no. 20% of the people between the age of 18 to 35, prior to COVID, who were absolutely healthy, they will also suffer from COVID, post-COVID lung involvement and other involvement. Now, if these patients on day 3 develop pneumonia, you don't give them anticoagulation on day 3 along with steroid. These patients will develop microthrombi. Ultimately, they will develop lung inflammation and lung fibrosis. These are the patients who will have a long COVID lasting for months together, dependent on oxygen and other things. Therefore, early treatment is very important. Next. What are the reasons? Reason can be ongoing respiratory impairment because of fibrosis. Then many studies have shown they have subclinical myocarditis, which can also cause breathlessness. So if your person has a persistent tachycardia, which is again common in 30% of the cases, it can be subclinical myocarditis, subclinical thyroiditis, persistent anemia, or persistent exertional hypoxia because of lung damage. And many patients who are serious, they can also have a post-intensive care syndrome, which also involves breathlessness. Next. So what is the future we are seeing? We will see a large number of cases coming with pulmonary arterial hypertension and right heart failure. If this inflammation is not tackled, we may start seeing an epidemic of autoimmune disorders, including the interstitial lung fibrosis, and we may also see inflammatory dependent future cancers. Next. Now, this is the most important slides for you. All of you, you are watching. Our purpose is to heal, but dharma, artha, kama, moksha. That means we also have to earn righteously. Now, these are the things which gives you a righteous earning. Let's say one by one, 6-minute walk test. everybody should learn. Take a SpO2 monitor, make the person walk for 6 minutes at 50 feet, have 2 chairs, and let them make the rounds and see how many rounds they make. Multiply it by 50, you will get the distance measured. If a patient is walking less than 200 meters in 6 minutes, he is high risk. If a patient is walking more than 500 meters in 6 minutes, he is a good risk. In between that, in between means he needs more reconditioning of the lungs. 6-minute walk distance will tell you whether your lungs are improving or not. 6-minute fall of SpO2 will tell you SpO2 oxygen requirement of the patient. A lung rehabilitation is incomplete without 6-minute walk test. This 6-minute walk test in all private sector hospitals is chargeable. It has to be done under supervision. You can measure 6-minute walk distance and you can measure the 6-minute walk oxygen, fall of oxygen. Second is peak expiratory flow rate. If you have this peak expiratory flow rate with you, before and after inhaler, you can check the reversibility of bronchial reactivity. And you can also check the lung capacity. So pre and post, you can have this simple equipment to find out what is the patient's personal best, use it on a daily basis, and check the respiratory function. Third, I've said is SpO2 monitor. Fourth is HRCT scan follow-up. At least the first scan should be done 1 week after the second scan should be done 1 week after the first scan to see whether the healing has started or not. Everybody should advise a home oxygen concentrator because in a post-COVID phase, you may require, person may be dependent on the oxygen and oxygen monitoring may be required at home. You may require measurement of RA pressure and RV pressure by echo to find out development of pulmonary hypertension. You require hemoglobin. Make sure their hemoglobin is normal. Make sure they are given iron tablet. One such tablet which our supporter FDC has is Vitcofol, VIT for vitamin, CO for B12, and FOL means folic acid. So it contains iron, B12, B6, and folic acid. Make sure you have correct use of mask. This is very, very, very important to prevent secondary respiratory infections. Then there are some Jugadu exercises. One is make them practice to lie down prone on their abdomen. If they sleep on their abdomen, the respiratory oxygen requirement reduces. Another thing, ask them to give them a balloon and ask them to blow it 3 times. This is 1. This is 2. So if they can blow it 3 times, this is a good exercise for them to do for a lung rehabilitation. You can also give them a water and give them a straw and ask them to blow it. This can give you a expiratory lung capacity. This can give you an expiratory lung capacity for that. Regarding masking, people who are specifically patients who are poor, cannot afford mask, or they can afford mask, but mask is not available, and you want them to be absolutely cured. Another Jugadu thing you can do is you can have a handkerchief, and in this handkerchief, if you want to make it airtight, you can have 3 rubbers like this, and the middle rubber you can put it on the nose, and these 2 you can put it on the ears, and this will become absolutely airtight. And specifically if you are going out in an outside area, you want an airtight mask, so you can use even on this surgical mask, because the air is leaking from the side. You can use a rubber band and you can put it here, and these two can come on the air, and this also becomes a airtight for some time. Normally, if this is a airtight, this something becomes like an airtight. So you can do a Jugadu airtight mask, you can teach. So why I'm teaching you these things is that to your patients, if you start teaching and start taking classes, all your patients, you can take a class electronically, 10 patients together. And if you show them these types of devices, they will feel happy, they will get rehabilitated, and you can charge your consultation fee. So these equipments can give you lots of extra earning at home. Remember, when you get an extra income at home by group counseling of the patients, patients also are getting benefited. Next slide. Another thing is very important is make sure all your patients, post-COVID patients, are protected from adult vaccinations. There are many, but when it comes to respiratory, annual flu and pneumonia is a must. Pneumonia is pneumonia 13 and 23. If it is person is 65 plus, just give them pneumo 23. Otherwise, you need to give them two vaccines at a yearly interval, first 13, then 23, then every 5 years, 23, you need to give them. Flu vaccine will need to be given once in a year. And by the time another 2 months, maybe in this month, you may see a COVID-19 vaccine also. I'm 100% sure that no government will afford not to launch their first vaccine in the month of December. The very fact the Prime Minister today visited the Serum Institute of India, I am 100% sure the first vaccine will be launched within this year in 2020, and that will be a credit going to the Modi government that they have launched a vaccine within the same year. Next. So coming back to the respiratory lung, COVID lung, what we have talked today in COVID lung is that respiratory rehabilitation is the most important. If you conduct your classes once in a week with your patients and help them rehabilitate, they will bless you both. I'm not even bothered about whether you are getting your fee. Of course, you will get your consultation fee, but they will bless you lifelong because they can prevent a post-COVID lung complications. If a patient ends up with a COVID pneumonia come COVID fibrosis, then there are multiple drugs available. Refer them to a chest specialist. Pirfenidone is the drug which at the moment people are giving. There are other drugs available which are very costly. Let it to be given by the chest specialist. But pirfenidone, yes, you can refer the patient to a chest specialist who can start, but then you can follow up these cases who are on possible interstitial lung fibrosis needing a reversal of lung fibrosis. That's the end of our introduction on post-COVID lung. And now we come back to the question of the day. Today's Whitcomb capsule question. The hallmarks of severe COVID are hyperferritinemia, hyperinflammation, cytokine storm, all of the above. Kindly answer your query and we will select 2 out of them and their name will be announced tomorrow as the winners of this particular quiz. Can I have the slides off? This presentation comes to you from IGCP Group and MedTalks and HeartCare Foundation of India and Confederation of Medical Association of Asia and Oceania, courtesy F for folic acid, F for iron, And remember the word DC, vitamin D and vitamin C. Company's name is FTC. They are supporting this program with a basic idea of making this country anemia free. Early diagnosis, early treatment, and at least some degree of post-COVID prevention if you are not anemic. Make sure you start taking your iron dose if your hemoglobin is low and you are anemic. Let me now hand it over to Anang Basu to continue and propose a vote of thanks to all of you who are visiting and attending this program.
So first of all, a big thanks to Dr. KK Agarwal, because the way you have taken the session of today, I'm sure all of our viewing doctors must have got the practical tips to not only manage the post-COVID lungs, but the way you have, demonstrated the lung rehabilitation process. It was amazing, sir. And I'm sure the 6-minute walk test and other things which you have just shown, I think now will be getting started at the different clinics of the doctors very soon in India. For that, I think only you can do it, sir, because the way you can have that small things converting into the practical way of teaching only comes from doctors like Dr. KK Agarwal. For him, I think I have no words to thank again and again. And for the viewing doctors, I have got only one message, that such pearls will only come in this channel or Dr. KK Agarwal's Facebook or MedTalks by Dr. KK Agarwal. I can only request you to follow this videos or the links to your colleagues, so that tomorrow when we come up with another episode of post-COVID management, many of your colleagues will be benefited with the pulse which is going on in our channel. So thank you very much. Have a very good night. Take care of yourself. Thank you very much, sir. Namaskar.
तो बोलो. That's all for today, and we have received a lot of questions. I've tried to cover most of the answers during my presentation, and tomorrow's program we will extend by 10 minutes, and we'll try to answer all the questions we have received in the last 3 days. Thank you.